Bipolar mood disorder. Bipolar mood disorder, commonly known as bipolar disorder, is a mental health condition characterized by intense mood swings that encompass depressive and manic or hypomanic episodes. These episodes can vary in severity and duration, impacting an individual's emotions, energy levels, and behavior. Depression. Depression is a key component of bipolar disorder, involving periods of profound sadness, loss of interest in activities, changes in appetite or sleep patterns, feelings of worthlessness, and difficulty concentrating or making decisions. These depressive episodes alternate with periods of elevated mood or mania. Cyclothymia. Cyclothymia is a milder form of bipolar disorder characterized by mood swings that are less severe than those in full-blown bipolar disorder. People with cyclothymia experience fluctuations between mild depressive and hypomanic symptoms, but do not typically experience the extreme highs and lows seen in bipolar I or II disorder. Dysthymia. Dysthymia, also known as persistent depressive disorder, involves long-term, chronic symptoms of depression. While less severe than major depression, dysthymia can still significantly impact daily life, causing persistent feelings of sadness, low energy, and a decreased ability to function normally. Antipsychotic pharmacology. Antipsychotic medications are a class of drugs used to manage symptoms of psychosis, which can occur in certain mental health conditions, such as schizophrenia or bipolar disorder. These medications help regulate neurotransmitters in the brain, reducing hallucinations, delusions, and other psychotic symptoms. Psychosis. Psychosis is a mental state characterized by a loss of contact with reality, leading to hallucinations, delusions, and impaired thoughts or behaviors. It can occur in various mental health disorders, including schizophrenia, and certain mood disorders like bipolar disorder during severe manic or depressive episodes. Delusion. A delusion is a strongly held belief that persists despite evidence to the contrary. Delusions can take various forms, including delusions of persecution, where individuals believe they are being targeted or harmed, and delusions of jealousy, involving unfounded suspicions of a partner's infidelity, among others. Understanding these aspects of bipolar disorder and related mental health conditions is crucial for effective diagnosis, treatment, and support. Seek professional help if you or someone you know experiences symptoms of bipolar disorder or related mental health issues to receive appropriate care and support. Types of delusions: delusion of reference, delusion of control, persecutory, delusion. Types of schizophrenia: paranoid schizophrenia, catatonic, schizophrenia, disorganized, schizophrenia, residual schizophrenia, undifferentiated schizophrenia. Types of delusions: delusion of reference. This involves the belief that insignificant remarks, events, or objects in the environment have a personal and particular significance directly related to the individual. Delusion of control. This type of delusion involves the belief that one's thoughts, feelings, or actions are being controlled by external forces or influences. Persecutory delusion. Individuals with persecutory delusions believe that they are being conspired against, harassed, or persecuted by others, often without any credible evidence supporting such beliefs. Types of schizophrenia. Paranoid schizophrenia, characterized by delusions or hallucinations typically related to a single theme, often persecutory or grandiose. Individuals with this type of schizophrenia may remain relatively coherent and organized. Catatonic schizophrenia. This subtype involves a range of motor disturbances such as immobility, catatonic stupor, excessive purposeless movement, catatonic excitement, or odd postures and gestures. Disorganized schizophrenia. This type is marked by disorganized thinking, speech, and behavior. Individuals may struggle with logical thinking and exhibit inappropriate emotional responses. Residual schizophrenia. When an individual has had at least one episode of schizophrenia but is currently in a less severe state, characterized by mild symptoms or a lack of prominent psychotic symptoms. Undifferentiated schizophrenia. This category applies when symptoms do not clearly fit into one of the aforementioned subtypes but still exhibit the core features of schizophrenia, including delusions, hallucinations, disorganized speech or behavior, and negative symptoms. Signs and symptoms, positive symptoms, exaggerations or distortions of normal functioning, e.g., hallucinations, delusions, disorganized thinking. Negative symptoms, diminished functioning or lack of usual functions, e.g., lack of emotional expression, social withdrawal. Antipsychotic medications, first generation, typical, antipsychotics, high potency, haloperidol low potency, chlorpromazine second generation, atypical, antipsychotics, aripiprazole, clozapine, olanzapine, lurazidone, quetiapine, risperidone, ziprasidone, haloperidol, and lorazepam, combination for controlling aggressive behavior. Side effects of haloperidol include facial grimacing, muscle contraction in the neck, face, and tongue. Priority action with haloperidol. If there are signs of neuroleptic malignant syndrome, NMS, hold haloperidol, assess the patient, and notify healthcare providers immediately. NMS is a complication of haloperidol. Atypical antipsychotics and ECG verification. Before administering atypical antipsychotics, especially ziprasidone, ECG and blood pressure verification are crucial due to the risk of QT prolongation. Antipsychotic side effects, extrapyramidal syndrome, EPS, A. Parkinsonism, B. Dystonia, C. Akathisia, anticholinergic effects, dry mouth, increased heart rate, urinary retention, constipation, low blood pressure. Other side effects, drowsiness, photosensitivity, high blood sugar, monitor glucose levels, gynecomastia, increased weight, ziprasidone. ECG verification is particularly important due to the risk of QT prolongation. Monitoring both ECG and blood pressure before administering ziprasidone is essential. It's clear you have a comprehensive understanding of these topics, covering the types of schizophrenia, their symptoms, and the nuances of antipsychotic medications.